Good evening. It's Tuesday, March 9, 2021 here in Cebu City. I'm Sherry Ann Lim and this is SunStar Tonight. Some 20,000 doses of the AstraZeneca COVID-19 vaccine are expected to arrive in Central Visayas tomorrow. This comes after private hospitals in Cebu City started inoculating their workers this week. Chari Coronel reports.
The Department of Health Central Visayas said that around 20,000 doses of the AstraZeneca COVID-19 vaccine will arrive in Central Visayas tomorrow. Nearly 500,000 doses of AstraZeneca vaccine arrived in Manila last March 4. Private hospitals in Cebu City have started their vaccination program to their healthcare workers. Chonghua Hospital started vaccinating its healthcare workers on Monday, while Cebu Doctors University Hospital and Perpetual Sucor Hospital started their vaccination today. Dr. Potenciano Iyong Larazabal III, President and Chairman of Cebu Doc Group, received the first dose of Sinovac vaccine to kick off the vaccination rollout of the Cebu Doc Group and to boost the confidence of its healthcare workers in the vaccine. For the first batch, 1,460 healthcare workers of the Cebu Doc Group are expected to get vaccinated from March 9 to 12 and will receive their second dose after a month. The Cebu Doc Group received a total of 2,923 vials from the DOH on its first batch of rollout, which will cover 2 doses for each of the healthcare workers. Chonghua had been allocated more than 3,500 doses of Sinovac by DOH and had already started the initial rollout on March 8, with 160 frontliners vaccinated. Around 70% of the Chonghua staff, including doctors, nurses, maintenance, security, and other support staff, agreed to be vaccinated with the Sinovac vaccine, while nearly 100 healthcare workers of Perpetual Sucor Hospital were inoculated. Meanwhile, Health Secretary Francisco Duque III confirmed that hospital admissions were rising as cases of COVID-19 have continued to increase in Calbayog, Central Luzon, Central Visayas, and Metro Manila. Pasay City and Malabon City have been classified as critical risk. Those at high risk are the cities of Navotas, Makati, and San Juan, all in Metro Manila. Those at moderate risk are Lapu-Lapu City, Ormoc City, Nueva Vizcaya, Santiago City, Ifugao, Mandawi City, Mandaluyong City, and Cebu Province. Chari Coronel, SunStar Tonight.
The Cebu City government will implement a coding scheme for the city's 80 barangays in regards to the entry to the carbon public market this Holy Week. This is to prevent a repeat of last year's Holy Week incident when a horde of shoppers flocked to the carbon public market to buy ingredients for binignit. Kenneth Torres reports.
Cebu City officials have learned from what happened at the carbon public market during the Holy Week last year. A crowd flocked to carbon to buy ingredients for binignit. This prompted the city government to implement measures to ensure health protocols are complied during Holy Week this year. The Market Operation Division will implement coding scheme for 80 barangays in Cebu City and other local government units that will be allowed to enter carbon on a daily basis. Cebu City Mayor Edgardo Labella said he already met with some city department heads and city police chief and agreed to start selling ingredients for binignit 4 days before Monday, Thursday on April 1 and Good Friday on April 2. Labella said during the duration, they will allow residents in 20 barangays to enter carbon in a day. The one entrance and one exit policy will also be strictly enforced at the market. The city has also coordinated with church officials to ensure traditional activities for Holy Week will remain cancelled. Kenneth Torres, SunStar Tonight.
SunStar Tonight will be right back after this short break. A total of 6 persons were killed in the shootout yesterday that claimed the life of Calbayog Mayor Ronald Aquino. Shari Coronel reports.
6 died and 1 injured in the gunfight involving the police and the camp of Calbayog City Mayor Ronald Aquino Monday afternoon in Labuyo Bridge, Barangay Lunoy, Calbayog City, Samar. An initial police report said Aquino and his security escorts were traveling in a van along Labuyo Bridge at around 5:30 p.m. when armed men aboard 2 other vehicles fired at the mayor's van. The official report of the police differs from the statements of witnesses. The police said Aquino's camp started shooting at the police, while witnesses said that the police on board 2 vehicles opened fire first. On the side of the police, fatalities included Police Captain Joselito Tabada and Police Staff Sergeant Romeo Lauyon. Tabada was the head of the Provincial Drug Enforcement Unit, while Lauyon was a member of the Provincial Intelligence Branch and PDEU. On Aquino's camp, fatalities included Dennis Abayon, the mayor's driver, and Police Staff Sergeant Rodeo Sario, the mayor's bodyguard. Justice Secretary Minardo Guevara said he has ordered the National Bureau of Investigation to look into the incident that killed Calbayog City Mayor. While PNP Chief Debold Sinas described the incident as a shootout, Samar 1st District Representative Edgar Mary Sarmiento said it was an ambush perpetrated by policemen wearing balaclavas and using high-powered firearms. Sinas said he received information that Aquino's group fired the first shot because they thought they were being followed by the Integrity Monitoring Enforcement Group and Provincial Drug Enforcement Unit. Aquino's family has yet to give a statement. Chari Coronel, SunStar Tonight.
A dialysis center has opened at the Cebu Provincial Hospital in Balamban town. It will accept patients from all over Cebu province. Kenneth Torres reports.
The Cebu Provincial Hospital in Balamban town now has a hemodialysis center with 10 new hemodialysis units. Sugbo News, the news arm of Capitol, reported that Governor Gwendolyn Garcia together with Deputy Speaker Pablo Jan Garcia inaugurated the center last March 4. The 2.8 million peso facility was previously the hospital's physical therapy rehabilitation center. The hospital's chief, Dr. Olivia Dandan, said that patients living in Balamban and neighboring towns no longer need to go to dialysis centers in Cebu City. At present, CPH Balamban has doctors who specialize in nephrology and cardiology, with 2 nurses are trained to operate the dialysis units. Dandan added that Capital has allocated 40 million pesos for a 2-story building that will house the hospital's outpatient department. Earlier, Garcia requested that the province of Cebu be included in the hemodialysis package of the Department of Health Facilities Enhancement Program to serve its renal patients amid the COVID-19 pandemic. Kenneth Torres, SunStar Tonight.
To get the latest, visit www.sunstar.com.ph. Follow us on our YouTube channel and official social media accounts on Twitter and Facebook. I'm Cherry Ann Lim, and this has been SunStar Tonight. See you again tomorrow. Good night.